Let us now welcome our host, CNN Philippines Senior Anchoring Correspondent, Ms. Pinky Webb.
Hi everyone, I am Pinky Webb and welcome to a CNN Philippines special presentation. This is our very first webinar titled A Brave New World, Understanding the Challenges and Choices in the New Normal, hashtag in this together. We really are in this together, whether we're family, we're friends, neighbors, and even strangers. So today we're going to speak to experts to help us understand this very complex world that we now live in. Our collective action and our understanding of each other will get us through our many challenges. So it's time to welcome our guests. There they are. First is Professor Tonette Angeles. She is Professor of Philosophy from Ateneo de Manila University. Thank you for joining us. And our next guest, Dr. John Bulaong. He's Executive Director of Governor Jose B. Fernandez Jr. Ethics Center and a Professor of Leadership and Philosophy, also from Ateneo de Manila University. We'd also like to welcome Dr. Antonio Miguel Dans. He's recognized in the country for his contributions to clinical epidemiology. He's also an assistant professor at the UP College of Medicine. And also with us, Professor Emmanuel Leco, an economist and president of Pamantasan ng Lungsod ng Maynila. Thank you to all of you for joining us this afternoon. So over the past months, the COVID-19 pandemic has raised ethical and even medical dilemmas. We are faced with so many choices day in and day out. And ultimately, it's really about promoting the common good. Our decisions can affect and change the lives of others. So let's backtrack a little bit. Middle of March, if you remember, we were under an enhanced community quarantine in Metro Manila. In other parts of the country, there were various quarantine restrictions and lockdowns. By middle of May, or 8 weeks or so later, Metro Manila was placed under a modified enhanced community quarantine. And then, I know it's a lot, at the end of May until the present, where we are now, we're under a general community quarantine. So we want to show you some images of the day one of GCQ, or the general community quarantine in the National Capital Region a few weeks ago. So that's what we saw. We reported about this. Our correspondents were in various areas of Metro Manila, such as Commonwealth. The problem was really, everyone was, would you say excited? Or probably they felt obviously the necessity to go back to work. Transportation became a problem. And if you talk to the DOTR, they always tell you that they did as much as they could considering health protocols. So nagkulang ng transportation for so many people, and they were very frustrated about this. There you see the buses were positioned in many parts of the country, but of course the problem was the jeeps, the mode of transportation of a lot of our kababayans, because in the inner roads, yun po yung ginagamit nila before they go to the outer or main roads, which became a problem. Yung iba naglakad ilang oras para lang makapasok. So let's talk about that too. MRT, it was operational, but of course, safety protocols were put in place. But again, let me just say, bago makarating sa MRT, nahirapan yung mga commuters, and then traffic. Traffic among those who have their private vehicles. So when quarantines and lockdowns were first imposed, many followed. Others reacted quite negatively. There were also those who resisted for one reason or the other. At the end of the day, until a vaccine or a cure is available, we'll have to live in some sort of quarantine. I guess we're going to have to get used to that. So let's begin. We want to ask our guests, can the state justify imposing strict quarantine conditions even for citizens who don't mind the risk that the pandemic poses to their own lives. For example, I'm going to say it, senior citizens, hindi ho ba, a lot of them felt that it was unfair that they were somehow focused on by the government because nandun nga sila sa tinatawag na vulnerable sector. So we want to ask first our medical expert, Dr. Danz. What are your thoughts on that?
Thank you, Pinky. First, let me start with my declaration of conflict of interest. I am a senior citizen, and I'd like to speak on behalf of senior citizens. The main reason we're not allowed to go out, anyone's not allowed to go out, is because we pose a risk to each other, right? Pero pareho lang ang matanda sa bata, hindi naman mas nakakahawa ang matanda eh. Ang kaibahan lang, I pose a greater risk to myself. Mas malamang na ma-hospital kaming mga senior kaysa yung mga bata. And in a way, the government has to consider that. Mas magastos kaming alagaan. On the other hand, bilang senior citizen, we are also vulnerable populations. Malaki ang pangangailangan ng senior citizens at hindi lahat kami may tagapag-alaga. Some of us still have to work to eat. And one might argue, it's harder to die of hunger than to die of COVID-19. Di bale, sana kung ikaw lang, kung may pamilya ka, di ba, mahirap. So for me, I think that provision, while it tries to protect us, it puts us at further disadvantage as well. And I feel it should be lifted as soon as possible. And the elderly should be advised to take precautions rather than required to stay home. My personal opinion.
No biases there, Doctor?
No biases, yeah. Objectively speaking.
Yeah, because I've had to tell my parents as well, kailangan ko sila pangaralan over and over again because it's what I've been hearing over and over again as well, that they are the vulnerable sector. So kailangan mas mag-ingat sila. And I'll tell you, they don't understand it either because para sa kanila malakas naman sila. So let's talk about this further with our two philosophers who are with us today. We want to hear from you. I'm going to repeat the question. Can the state justify imposing strict quarantine conditions, even for people or citizens who don't mind the risks that the pandemic poses to their own lives? Let's ask Professor Tonette Angeles.
Thank you, Pinky. I'm also a senior citizen. So I also have conflict of interest here. I don't really have a fundamental objection to being asked not to go out because of my age. It's just that, as Dr. Danz was saying, that I pose additional risk to other people is not very clear to me. What is clear to me is that perhaps I'm more vulnerable compared to others, but I think I should be the judge of that because some senior citizens are the ones running industry, are running schools, and also some senior citizens, because of age, take care of themselves much better, and probably they're stronger than their children who think that they are invincible. So I think we should be the ones to decide for ourselves whether we should stay home or go out. Thank you.
Professor, did you talk to my dad about that?
Yes, your dad, I'm sure, is very healthy.
Yun ang sinabi niya. Dapat ako, I should be able to decide for myself. And there is absolutely truth, and that's very factual as well, because a lot of senior citizens head companies. Actually, a lot of them also, a number of them are members in Congress as well. So yeah, nandun yun. All right, maybe Dr. Bulaong, what about you?
Yeah, thank you for the question, Pinky. I liked that you began with, in your introduction earlier, you began by talking about the common good. I think any kind of imposition, any kind of state intervention in our lives has to be justified with the common good. And I think that's that's in the minds of the people who are making these decisions. And I'd like to think that it's often in their minds. No? So while it's good that we're thinking about, individually, each senior citizen, and I have a lot of respect for senior citizens in that particular context, to be able to make decisions on their own for themselves, it has to be mitigated and it has to be calibrated along with the common good. And as Dr. Dance and Dr. Angel has already mentioned, it has to do with it, are not how possible it is, for example, for other people to get infected because of people who are able to go out. So in that particular context, the common good is vague. So, I mean, we can talk about the common good in this case as if it were some abstract concept. But I like that there's some degree of metrics, there's some degree of measurement that the government is using. Just as an example, it's not perfect, of course, but just the calibration from the enhanced quarantine to the modified enhanced quarantine. And there's a gradual and calibrated easing of the different sectors and the different areas of our lives. No? So I think there has to be some calibration, and I hope there are many people in government, decision makers, policy makers, who have the common good in mind, weighing those things. That's my opinion.
But would you say that absolutely that was the basis for, you know, focusing especially on the senior citizens, because to government, it is for the common good.
Yes. Pinky, we share the same experience. You told your parents, sabi mo, sinermonan mo yung magulang mo. We did that for both my wife's parents and my parents. I hope they're not listening right now. I didn't give them the details of this so that I can talk about them. My father, for example, very concretely kept having, for one whole week, for 2 weeks, kept having neighbors come in. It was a very strong, and the bond in the community is strong. So he had neighbors come in, the children. And we were, I mean, the children, my brother and I were greatly concerned about that because it's so easy for them to get infected. So it's in that context that I hope that their individual decision-making for a time can be in a calibrated way, can be controlled by the state insofar as it's for the common good.
Okay, so in a pandemic like this, science will always be the basis for many decisions that are made. Let's talk about how government takes into account which industries should reopen first. Our economist in our virtual room, Professor Emmanuel Leco, can help us better understand that. So, nung binuksan po yung mga industries, of course, government had to consider which ones should open first. So what are your thoughts on how that actually happened? Okay, Professor, please unmute. We can't hear you right now.
Okay, thank you. Sorry.
Okay. Can you start again,
Sorry.
please?
Okay. Well, first of all, I need to make this disclosure. I joined the two other panelists this afternoon as a senior citizen, and actually, I won't consider this as a conflict of interest. I think as an interested sector, curtailing the freedom of the senior citizens, one of the most serious decisions that they made. If they implemented that, perhaps the government will stop running, perhaps the private sector will stop running, educational institutions will stop running. In fact, when I heard that, I texted a friend of mine who is still in the cabinet today, and I said, paano ba yan? Senior citizen na ako, I cannot go out. Unfortunately, I have a university to run. So what do I do? And that's when they said that those senior citizens who have a job can go out. And I don't think that is good enough. Senior citizens, come on, 60 years of life, 40 years of adult life. I think we can all trust our senior citizens that they have gone through a lot and they have already acquired that decision-making skills that are necessary to navigate through this pandemic. Now, let me go back to the topic that you asked me. Now that we are reopening, what industries should we open? I think the first few clips that you showed would be very, very telling. Transportation, you cannot stop. Transportation has to continue no matter what. You might have to moderate or stop in some areas, but you cannot stop our you cannot stop transportation altogether. So if you ask what transportation, what industries we should start with, transportation is one, but I think we should be guided by logistics management. We have logistics that we need to continue to run no matter what. For example, food. When they said that essential industries like retail, food retailing, food delivery, and so forth need to continue. Our groceries, our department stores, our supermarkets found that they were only getting less than 50% of their staff able to report. Why? Because of transportation. I think what was missing in our approach, in our response to this pandemic was the attention, the important attention needed to focus on logistics, our supply chain management. Our food was critically at a very, very risky stage. People are panicking. In fact, in the first few days, people were panic buying, and I can understand why they were doing so, because they were seeing that the supplies, the grocery stores were emptying out. And I think one way of assuring our market is that we are able to maintain supplies in distribution centers. So that's number one. We have to make sure transportation is back. Transportation has been a problematic issue for us even before the pandemic, and people should have known that. The jeepneys is the mass transportation. We don't have a good mass transportation system in the country today. The jeepneys, the tricycles, they are essential components of our public transport. So when we stop them, and right now they are still not allowed to go out, we have a major problem with our transportation. Now, it is true that those who are using jeepneys, buses, and tricycles could expose others to the virus. And therefore, that should be the focus of our disinfection. That should be the focus of our attention. How do we make jeepneys, how do we make tricycles, how do we make buses safe vehicles for transporting our masses? Because we don't have a mass transport system in the country today. Very few have private vehicles. So that was a terrible thing to do.
And I guess, Professor, dumating ho kasi sa punto that obviously, as you mentioned, we have problems with transportation prior to the COVID-19 pandemic. Problema na po yun before, tapos naging problema pa ngayon because there was a limited number of transportation available. And then, government kept encouraging the private sector to provide transportation for their employees. Problem with that is, the private sector, especially the SMSEs, they were already having problem with, obviously, no profit, a lot of losses there, and then they had to shoulder transportation as well. All right, so I'm going to move on though, because
Pinky? I know I'm a philosophy teacher, but may I say something about that?
Sure.
Because the forum is looking forward. So now that we have open basic industries, I'd really like to understand what metrics we're using in deciding which companies, which industries we will open up next. Because whether we like it or not, the health risk is still there. So for instance, they've already decided to open tourism. So I would imagine it's because of the percentage of the country's economic activity comes from tourism. So I think, you know, as an ethics teacher, we always say we have to balance what are the issues involved here and what is more important for us. Because otherwise, if we do not sacrifice certain industries because the health risks there are much greater than the others, then we might as well open everyone. So I think there still has to be, tawag dun sa Tagalog, kailangan pa ring salain. At tatanungin pa rin, ano yung mas mahalaga? Yung bang pagbukas ng mga industries na yon o yung health risk? Dahil meron talagang iba, ang taas-taas talaga ng health risk ng industries na yon. So for me, that should be the framing of the answer to that question.
Okay. Professor, salamat po. Let's ask Dr. Dance his thoughts on that. Kasi nga, again, we talk about this science normally, for the most part. It's really the basis for the decisions of government exactly on which industries can reopen. Dr. Dance, go ahead.
I help a bit Pinky's analytic group advising the interagency task force. And the metrics involved are, well, I think the first one, the most important criterion for which industry to open is there an essential need for that service? And second to that is the risk associated with that industry, their exposure to infection, the risk of spreading infection. But first is if it's essential. For example, medical services are very high risk, but it's very essential. So it was never locked down, at least in terms of hospital care. Now, less essential would be outpatient services, and that was opened only recently, and there are strategies to mitigate the risk of infection when you render outpatient medical services, such as telemedicine is now becoming widespread, and a lot of practitioners are rendering healthcare through that. The food services are essential. So despite the risk, we opened up food delivery, and later we opened up restaurants if the workplace can be modified. So those are the two important things. Is it essential? And number two, what are the risks associated with the services that are delivered there?
All right. You know what? I want to actually read a comment from someone who has had to go or report back to work. So here's what Charles Dagdag said. He said, as someone who will be reporting to the office, the transition from ECQ to GCQ is truly frightening. Knowing that the government has no concrete plans for its people and the tests made haven't exceeded 1% of our country's total population. Let me ask first, Professor Tonette, would that be a fair comment?
First of all, I think it's a bit harsh to say that the government has no plan at all. We may disagree with it, and I have my own disagreements with it, but there probably is a plan. However, I think the fear of Charles, is that Charles, is very real. No? And on the one hand, kailangan niya magtrabaho dahil kailangan niyang pangalagaan ang pamilya niya, but on the other hand, there's fear for his health. So I think when the government put us in GCQ, to a certain extent, it was saying to us, we've protected you long enough, now you go out and to a certain extent at your own risk. So this part, I think, of our lockdown, if it's still a lockdown, is really private citizens as well, making sure that we pay attention to how we behave when we are outside. So for Charles, I think Charles, if he really has to work outside, he has to have extra protection, all of social distancing, masks, and so on and so forth. Because at a certain point, we really have to go out and work already.
Yeah. Dr. Dance, what's your reaction to that? Dr. Dance, please unmute.
Sorry.
Okay, go ahead.
Yeah, so I think the greatest fear of people at work is that there may be asymptomatic carriers around them. And that's why the testing was mentioned. And I think when we're worried about going back to work and there might be sick people who aren't feeling sick around us, there are two ways to protect ourselves.
Okay.
Number one is through mass testing. And I hope you give me an opportunity later to talk about what the best test is. And the second is to assume that everyone is a carrier. So
right.
Like Tonette said, wear a mask, practice physical distancing, wash your hands. So those are our two protections. But about mass testing, people recommend swabs, PCR, or the rapid antibody tests, which are blood tests. But these are expensive and inaccurate. No? There is no way we can do it on everyone. But there is one alternative that few people know about that you can do on everyone, and it's cheap and affordable.
Which
And
is?
it's called the 14-day symptom test.
Uh-huh.
It's recommended by the WHO, the Center for Disease Control, and our leading scientists in the country. It consists of 2 questions. No? Number 1, have you been closely exposed to a case of COVID in the past 14 days? And number 2, have you had flu-like symptoms in the past 14 days? If you answer yes to any of those questions, you're given 14 days leeway before returning to work. No? Yan, mura lang yan, reasonably accurate, sensitivity and specificity are more than 90%. And we can do that for everyone in the country if we want.
But I need to interrupt you there.
Yeah.
Because the 2 conditions you said, yung una, were you exposed to someone with COVID? And number 2, do you have flu-like symptoms?
Yes.
The problem with that, Doc, is that sometimes you don't know if you were actually exposed to a COVID-19 positive patient. Hindi ho ba?
Yes, exactly. And that's why if your answer there is no, you're still screened by a second question. Have you had symptoms in the past 14 days? No? Yeah, actually, yung fear dyan, Pinky, ng mga tao is people denying symptoms. No? Kasi may economic impact yun eh. And for us, that's one of the new brave things we should do. Cultivate a better normal where there is trust between workers and employers. So workers must learn to admit their symptoms and stay home when sick. No? Alam nyo ba yung presenteeism? That should be discouraged na. Yung presenteeism, yung we praise people, itong galing nito, may sakit siya, pumasok pa siya. That should not be something we propagate anymore. We should, in fact, allow people to work from home if possible, if they're sick. We should increase sick leave benefits and social amelioration for people who are sick. And we should, important, provide health care when our employees get sick. That's the new normal, and we should be nurturing a sense of trust between workers and employers, because if we cannot trust each other and we always suspect people are lying, then we need to test everyone, and not only once when they return to work after 3 months. We have to do those tests every day, because paano mo alam, kung nagka-symptoms yan the past 24 hours since they last returned to work, hindi ba? It's impossible to do mass testing using lab tests.
All right. Marami po kasing nawalan ng trabaho. Businesses all over the world are facing their biggest challenges in the industry. Here in the Philippines, unemployment is actually up 17.7% in April of 2020. That's around 7.3 million Filipinos amid the COVID-19 pandemic. Let me go to Professor Leyco. Here's a question. Given, Professor, the circumstances, at what level ho ba? And I'm sure we've been touching on this a while ago, yung level of economic cost, are quarantine regulations justified? And at which point does the economy have greater weight? You know, ang simpleng tanong talaga dito eh, life versus livelihood. Professor Leyco, go ahead.
Thank you. Actually, I think this is where the economics of healthcare come in. It will be very, very difficult to say that there is a dichotomy between economics and healthcare. And you can separate healthcare conditions of the people without looking at the economic impact of these health conditions. And also, when they say, if I go back to the comment of Dr. Dance, saying that the most cost-effective, the cheapest way to control the pandemic is through 14-day quarantine. I agree with that. I totally agree with that. However, in a country like the Philippines, with the economy that we have, no work, no pay ang mga tao. Pagka hindi ka nagtrabaho, wala kang kikitain. At your choice becomes gutom ba o sakit. And people will always say, no, I'd rather choose magkasakit or the risk of magkasakit kaysa sa magutom. Ramdam na agad nila yan eh. Now, should we move based on a clear dichotomy between economics and healthcare? I don't think so. I think that is what is missing with our decisions right now. And I am glad that the government is already saying, when Congress said that they are looking at social amelioration stimulus package in the trillions, the government said, we don't have trillions. The Constitution says you cannot do spending without additional revenues. And that is strictly simple accounting. You cannot bury the people in debt for something that you don't already have. And therefore, this question goes back to your earlier question, what kind of industry should we start reopening? And this is where I think we need to go back to the fundamentals of our economy. The economy should feed the people. And therefore, in terms of priorities, the priority should be defined in terms of what industries feed our people. Does tourism feed our people? Yes, indirectly. But directly, food production is our major industry here. And unfortunately, we have already gone into that economic strategy where our food security is defined by our ability to buy food, import rice from somewhere. Unfortunately, that is not the case anymore. Our economy has been fed by remittances coming from our overseas Filipino workers abroad. And right now, many of them are stranded in airports. Some of them are here in Manila already. And I was looking at the data before coming here. 20% of our remittances are coming from our sea-based workers. So what does that mean? Those who are working in cruise ships, those who are working as seamen, they are the ones who were first hit by the pandemic. There are no cruise ships moving right now. So what does that mean for the Philippine remittances? At the minimum, 20% of our remittances will go down. And that is just coming from the sea-based Filipino workers. How about the land-based? Many of the companies in the US already experienced lockdowns and closures. In the Philippines alone, more than 2,000 of our companies have already closed. So we're looking at more than, I think, this is just my personal estimate, more than 20% of our remittances will disappear. For the economy, that will be a major blow. Major blow perhaps on our consumption. The Philippine economy is a consuming economy. 60% or more of our GDP comes from consumption. And when there are no more remittances supporting our consumption, that will be devastating for our economy. I don't think we are going back to a new normal. We are going to see a new order. The economy will have to be rearranged. Our means of production, our modes of production will have to be rearranged. And I think more importantly, the philosophy for our economy will have to change. We have to start building our confidence by saying that we are able to produce what we need in the country. We cannot rely on imports. Other countries also have their own worries. They're not going to export the rice to us when they know that they are also going to have problems with that. Chinese or factories in China that were established by Americans, by the Japanese and the Europeans, they are leaving in droves. Unfortunately, I haven't heard of a company leaving China coming to the Philippines. And I think that is going to be a major problem for us. That is a wake-up call. What happened to us during this pandemic challenges us in terms of how we should look at our economy, how we should protect our people, and what kind of economies, what kind of industries do we put on top of our priorities. And I think when we say the economic fundamentals, we have to redefine economic fundamentals by saying that those industries who feed our people directly should be on top of our priorities.
Be the one prioritized. Okay, paano naman po yung mga tao na hindi pa makapagtrabaho pero kailangan na magtrabaho? Let's ask Dr. John Bulaong that. Paano naman sila?
Yes, Pinky, the issue about unemployment is just one symptom of a bigger problem. And the bigger problem is poverty. So I wanted to re-echo what Dr. Leiko mentioned earlier about the new, that we're not really going into a new normal. We need to come up with some kind of new order. I find that very exciting, that claim, no? Because at the beginning, if you remember, in March, in April, I have good memories of people were often, in many conversations, people were saying, this kind of pandemic reveals the vulnerabilities in our society, the vulnerable sectors in our society. And I think that unemployment is just one among many of the vulnerabilities that were revealed in that context. So this points to the fact that the issue is not systemic. We found some degree of, we found the government started giving aid. There are different kinds of aid. There's emergency aid, there's charity-based aid, and so on and so forth. But these really do not solve the problem. I hope you don't mind if I use a short test. There's this story of an insane asylum test. I hope it captures our imagination about what solving a systems problem is. No? An insane asylum test is they let people into a room, and then on one side there are faucets that are open. On the other side there are brooms and buckets. They test for insanity by seeing who will go and turn off the faucet and who will clean up the water that's on the floor. I hope that's a simple example to capture our imagination that the problem of unemployment, which is embedded in poverty, in the problem of poverty, is systemic. So I'm worried, I'm a little worried actually, that we're hearing less of that conversation about how to alleviate poverty. Of course, we need to solve the immediate concerns that we have now, but I think the conversation has to continue about how to solve this in the context of risk management. So this is an ongoing, and I like you, at the beginning you said that this is collective action. I actually dream of a committee on a high government level where there are systems thinkers who are trying to solve, trying to synthesize, put together the ideas, the supply chain, the food production, and so on and so forth, and coming up with systemic solutions to a systemic problem. It's my contribution in that case. No?
I guess a lot of that would really mean being proactive, looking into the future, and it's a lot of really coordination among, well, a lot of agencies of government. So I want to read another quote. This is from a head of the family. And this is coming from Dante Luzaran. Here's what he had to say. Ang sabi niya, bilang isang padre de pamilya, gusto ko pong bumalik na sa trabaho para kumita. Kahit na ako ay matanda na at sinabing mas madaling magkasakit, ang hirap naman na walang laman ang sikmura. Okay, we talked about that a while ago. Ang sabi nga, sakit ba o gutom? Ang pipiliin daw ng Pilipino ay sakit na lang kaysa magutom sila. Let's start with Professor Tanet.
In a way, pareho ito sa tanong ni Charles, di ba? Yung tanong niya kanina, nakakatakot pumasok. I think to a certain extent, the pandemic showed some what Dr. Bulaong called systemic weakness of the government. And I think if we are to stay faithful to the theme of this webinar, which is the new normal, I think the responsibility of government in the new normal is really to review its priorities. And I think the priorities should focus a lot on safety nets. For instance, health. The weakness of our health system has been exposed, and also our inability to address the needs of a really, really poor people has been exposed, and our food production has also been exposed. So to a certain extent, and in times like this, if we had good safety nets, yung talagang mahihirap sana, yun talaga yung masalo. At kung hindi sila makapasok, tulad ng sinabi ni Dr. Dance kanina, meron tayong mga pang-ayuda sa kanila para hindi sila kailangang, they don't have to risk the exposure. So, I don't know what to say to this gentleman who wrote to us, but my own thinking is, to a certain extent, at this point in time, that decision is going to be his. And I just hope and wish that his company and government, which has responsibilities, will make it easier for him to go back to work.
Dr. Dance, what about you?
Hirap ng mga tanong, ano? Yeah, well, alam mo, yeah, I don't know if you've heard some sayings early in the pandemic that the pandemic does not recognize social class because it affects everyone. When I first read that, I strongly disagreed. Kasi I think while the virus does not choose people, the disease affects people very differently. And naghihirap tayong lahat, pero merong mas naghihirap at merong hindi masyadong naghihirap. I think we should, what this pandemic has highlighted is that there is so much inequity in society. I would summarize the problems of the poor in this pandemic in 3 ways. No? Number 1, walang trabaho. Number 2, hindi makapuntang trabaho. Number 3, walang pambayad pag nagkasakit. No? All of those are related to the pandemic and related to systemic problems. No? So yung walang trabaho, syempre we have band-aid solutions like social amelioration, but the real solution is to resume and run the economy, put it back on its feet as soon as possible, and revise relationships between workers and employees so that there is mutual trust. Yun namang di makapuntang trabaho, napaka-importante. Our latest survey shows that 20% of households have cars. No? Even less. And 80 to 90% of households don't have cars. And yet our roads, that's what's exposed in this pandemic, is that our roads are for those with cars. No? And that's why I like the attention that has recently been given to mass transportation. No? Improving mass transportation, because that's what most people use, and then giving access to active transportation. People can walk or they can bike to work or take some sort of active transport back to work, because 90% of households have no cars. And then yung walang pambayad sa sakit, ang laking problema niyan all over the world. Almost half of the excess deaths these past 3 months around the world, in many countries, half of them are not from COVID. Half of the excess deaths are coming from non-COVID illnesses that were neglected during the pandemic. We don't have that data, but if it's 50% in rich countries, can you imagine what's happening to the poor out there? And so this has shown us that we need universal health care now more than ever. And I'm worried about that part of the government approach, which is maybe we should delay universal health care to 2022, because no, we need it now more than ever because of those 3 problems that the poor face today. And I think it's the responsibility of those who are less stressed to take care of those who are devastated by this pandemic. So we're all affected, but we need to show concern for those who cannot go to work, who have no work, and who have no money to pay for their illness when they get sick.
Dr. John, what about you?
Pinky, sorry, what's the specific question? This is a reaction to Dante, right?
Yung sinabi niya na kahit na ako ay matanda at sinabing mas madaling sakit, sabi niya ang hirap rin na walang laman ng sikmura.
Yeah, this goes back to what I was saying earlier about what Dr. Dan said about band-aid solutions. I mean, people who will wipe the floor and not try to... But these are immediate solutions that have to be addressed, no? it's in that context that I want to step back. I want to step back from the question between economics and health. On the surface, it looks like it's a choice between economics. We need to open up so people get to go to jobs, will go to their jobs and earn their money and so on and so forth. And then businesses will stop closing and so on. On the other hand, there's the seeming apparent tension that you can't go out, you can't open up because people will get sick. I think that's only a surface problem. If we step back and we mitigate that, calibrate it, as I was saying earlier, if the opening up is based on a calibrated approach of using the metrics, using a certain set of metrics that Dr. Angles was saying earlier, I think the health is and the economy are not really at odds.
No.
The economy will support the health, and the health sector will, of course. No, but it's in this context. Can panelists ask a question?
Yeah, go ahead.
Okay, yeah, sure. I read the omnibus guidelines a few days ago, and the most recent, I think, was released in early June. And there was this term that caught my attention. The term is local risk severity grade. On two different pages in the omnibus guidelines, there was mention of a local risk severity grade. And I found that interesting because it identifies that there are metrics already that the government is using in order to evaluate, grade certain localities, certain areas in the country. And except that when I searched it online, there was hardly anything that I saw. So I'm hoping actually that one of the other panelists could answer. How is that evaluated? How is that measured?
Mm-hmm. Anyone, feel free to respond to that, please.
Well, if I may, what I gathered earlier was that one of the things that they are using to classify whether you go ECQ or you stay GCQ or modified and so on and so forth, they also evaluate your ability to address the pandemic. If your capacity, your healthcare institutions' capacity is such that even for 10 cases you are not able to address, you should be on a very, very strict quarantine because your ability to address the issue is not there. However, there are some cities that might have more, but then in terms of their capacity, their institutions, the personnel are there, so they're okay. But going back to what this is exposing, I think we have a consensus that this pandemic revealed the weaknesses of our institutions, and in particular, our healthcare institution. We are worried that our healthcare system will be congested, will be under stress, because if you recall, healthcare has been devolved to the local government units in 1990s. However, the success of that devolution, I think, I don't think it's there. I think many of our local governments are still not able to address healthcare locally. We're still referring to either the private healthcare institutions or the national government to address our healthcare. So when we are so worried about the numbers because our healthcare system can only accommodate very few. Everybody who's feeling something will go to the hospital. Our referral system is just not there. There's no primary, secondary, tertiary. Ang marami nga sa ating mga local government hospitals are mostly maternity hospitals. Although ang classification nila are acute care, no, they are not performing acute care. They're not delivering acute care services. So I think if we're looking for a positive outcome from this pandemic, is that we should take a look at our healthcare system. We have to be prepared. How do we prepare for that? we have to rationalize our healthcare referral network and only direct people who need acute care to the acute care hospitals, and primary care should go to the primary care hospital. However, people will not go to a local government unit if they see that the local government unit hospital has no facilities, has no medicine, has no doctors, and then the National Health Insurance Program, I understand, is being considered to be deferred. I think there are some reasons why we should defer that, but I don't see any reason why we should defer strengthening the capacity of our local government units right now to take care of its own residents. I think the earlier statement about COVID hitting everybody does not differentiate the rich from the poor. But I think in terms of how the poor is being hit, the poor, when they get hit by COVID-19, it's devastating. It means hunger, it means loss of jobs, it means loss of their economic livelihood. And therefore, I support the earlier statement that when we look at our response right now, we should be differentiating about who is getting hit more, who is getting affected more, who has the capacity and who doesn't have the capacity. I think healthcare as a public good, I think it's very clear right now. You cannot differentiate and say only those who can afford will go to the hospitals, because everybody will get sick if the virus goes around. And therefore, it is important that the government financing will focus on how do we make sure that everybody is taken care of by our healthcare system, a system that is rationally distributed. It is, I think, very timely for us to provide encouragements for our Filipino healthcare workers to stay home. I don't blame them if they go abroad, if they go to UK, if they go to the US, because the salaries that they are getting paid here in the Philippines right now is so little. It's hardly affordable. It hardly makes maintaining a family affordable.
So a lot of vulnerabilities exposed in the country because of this, mentioned by everyone. It's good that, we know that. It's just highlighted now. And I think that another part that we're forgetting, of course, is a lot of funding for research and development, which has always stayed at the bottom of the food chain in terms of funding. So when we're talking about numbers, we're talking about critical care capacity, as Dr. Dans was saying, of course, case doubling rate. These are the metrics being used by government to determine whether a place should be under GCQ or ECQ. Another is this: every aspect of our lives is impacted by COVID-19. Alam naman natin lahat yan. Ito yung isa, religion. That's one of them. Some places, worship are allowed to reopen provided they follow strict social distancing. Ito, to our two philosophers again. Do we need to be physically present to fulfill our religious and spiritual needs? And sasama ko na to, how do we say no to people who want to turn to God for help, for peace of mind, for comfort? I'm going to start with Dr. John.
Pinky, this is entirely my personal opinion, but if I can make the answer parallel to exposing vulnerabilities, I think there should be a difference between piety and having faith, having a deep religious connection with Creator. The inability to go to church reveals, I think, that one is unable to exercise piety because I cannot kneel down and pray. I'm not dismissing the importance of piety in the exercise of faith. Okay, but I think it's just an expression of a genuine faith. If the inability to go to church makes me, diminishes my connection to my Creator, I think that's another of the vulnerabilities that are revealed if we're unable. Wait, please don't, I cannot say don't quote me on this, but at the very least I can say that we need to be able to express our relationship with God. That's very important. And the church absolutely is whichever religion or whichever church one expresses that is at the center of that expression of faith. But in these strange times, I think it's also another opportunity to step back and reveal and reflect to oneself and really understand what it means to have a relationship with the Creator. Just my 2 cents in that case.
Right. Okay, Professor Tonette.
Pinky, I must confess that the online masses are wonderful. And one more thing, it allows me to attend the masses of my favorite religious congregation, the Society of Jesus, okay? Because then I have a different Jesuit every day. But kidding aside, I read that in fact, I'm a Catholic, obviously, and many Catholics are asking for them to go back to church. The church talks about sacramentality and spirituality, and in fact, that word sacramentality now appears in that prayer during communion. I cannot be with you sacramentally, so I'm here, you are with me spiritually. So there is a value to going to Mass for 2 reasons, because there, the physical thing, which turns the body and blood, the bread and wine becomes the body and blood of Christ. That's one of the greatest mysteries of the Catholic Church, of the Catholic religion. So we're there and we witness that. And the other thing I think that going to Mass brings is that we are with the community, which is not quite the same in an online Mass. So while I understand, of course, there is this push for us to go back to church, again, we have to frame the question. The question is, at this particular point in time, given our context, what are the competing values here? Is sacramentality more important than perhaps the health risks of people at the moment? And that is something which I think our bishops have to grapple with, whether we are going to be asked to go back to church now. And I feel that for me, I also have to make personally that decision. Even when I go back to church, when I'll be allowed to go back to church, my question is, is sacramentality now going to overtake my need for to protect myself against health risks, especially if the health risks are still very, very real? Very quickly, about 2 weeks ago, the gospel readings were about Jesus Christ scolding the Pharisees, saying that while rules are very important, more than the rules is the spirit behind Christianity, and that is love and compassion. So for me, that is my guiding principle about this whole push. Should I go back to church or not? Thank you.
Thank you, Professor. Education. Okay, it's another aspect of our lives that's affected by the pandemic. As you know, the President himself said, habang walang bakuna, laro-laro na lang muna. Sabi ni Secretary Briones, wala daw face-to-face muna. That's how she called it. Online learning has become the norm, but it doesn't work for all for so many different reasons. Here is something I'd like to read. It's a comment from a student. Ang sabi po niya, as a student, hindi ako sang-ayon sa online class this academic year. First of all, not all students have access to internet. Second is the quality of education. Maraming differences between online and face-to-face classes. Hindi pa ganon kadali matuto ang isang estudyante online. My mom and I have the same decision that I'm not going to enroll this coming academic year. Health is very important. Yung pangarap, matutupad pa rin naman yan. Let me repeat this. My mom and I have the same decision that I'm not going to enroll this coming academic year. Health is very important. Yung pangarap, matutupad pa rin naman yan, late nga lang. Pero ang buhay ng isang tao, once na wala, hindi na maibabalik yan. Thoughts on this? Let's start with Dr. Dance. Hirap?
Yeah, but what a smart student, di ba? She assessed the situation and assessed the risk and made a decision for herself. I think her decision is quite well justified. But the question should be, what should we do about it? How can we avoid students having to make these decisions so that they can continue their education uninterrupted? And for me, speaking from the point of view of the university, three things need to be happen so that Jasmine's crisis is not propagated. Number one, we need to restructure the learning environment. Classrooms can no longer be the crowded classrooms that we normally see, right? Second, we need to restructure operations. So maybe classes can't be every day anymore. Maybe it's Tuesday, Thursday, or Monday, Wednesday, Friday, and we need to lessen the contact. Number three, we need to revise curricula, and especially in postgraduate education, increase the opportunities for distance learning, so that you don't have to go to the classroom to learn. But fourth, and for me most important, Pinky, is to address an inequity, again, that has been exposed, which has existed all along. And that's inequity in information access. Estimates have it that as much as 60% of Filipinos are not connected. And we've been trying to connect them. And there are solutions. We're one of the few countries that don't have our own original Philippine-made satellite. But we need to provide access to people, to the 60% who have no access, because that's not just education that has implications economically for families. It has implications in terms of information access, not just education. And I think that's something we need to address. The DICT especially has to address that as soon as possible, because for me, that's an emergency. If you are jobless and hungry and you can't get to work and you have no access to healthcare, well, the other injustice is when you can't access information because there's no internet access where you stay. We need to solve that problem.
Dr. Dance, I think you were the one, if I'm not mistaken, you were the one that said you started with transportation, that transportation should have been thought of when we opened industries. Was that you? Did that come from you? And then now you're
Yes.
telling us almost a parallel comparison. You're saying you're saying that classrooms should not be full. Classrooms are full.
Yes.
You have shifts in classrooms, and we have to adjust that. And I don't know how that would even be possible to do that dahil siksikan po sila, shift po sila, hindi ba?
Yes, so that's why you need to, well, first you need to redesign them. That's just one thing. And how do you redesign it so that they can sit further apart? By spacing classes apart, by providing online classes. But as Jasmine pointed out, not everyone has that. So, but when we solve that problem, that opens the doors for decongesting the actual classroom that students visit.
All right. I want to ask Professor Tonette as well. What are your thoughts on that? And let's not just put this on students. Teachers have a problem. The teachers who do not have computers, who share their computers with their asawa, yung kanilang mga anak, they're asking for some sort of allowance for internet access. Ang laki po ng problema. Professor Tonette, what do you think?
Hindi ko masisisi si Jasmine kung iniisip niya hindi siya papasok. Kasi truthfully, yung paradigm ko kasi very private school. Kung kami nga private school kami, we're trying to equip everyone to make sure we roll out quality education still online, because here we're even making a difference between online education and distance learning, because to a certain extent we're told that if it's distance learning, it's very difficult to monitor the students. So paano pa nga kaya, Pinky, yung mga public schools, yung basic ed natin is dominated by public education. Nasiksikan yung classroom, tapos yung mga teacher walang access sa computers. Sa totoo lang, ayokong maging si Secretary Biones at this point in time. Kasi ang laki-laki talaga ng problema sa public sector. No? Siguro I must tell you that private schools are anticipating losses and some are already declare that they will close. So how can we best prepare? No? Again, we will come up with, to a certain extent, some band-aid solutions. And I hope we will not do great disservice to this generation of students. But again, the great divide will show. It will show. We only have 2-3 months. Even if we follow the suggestion that we start school in January, that's still a very short time to prepare. Perhaps some private schools can equip themselves, but I doubt very much if the public schools can do that. The best bet, I think, is distance education. It's really their best bet.
Just very briefly, Professor Tonette, what are your thoughts on delaying? Anybody who's thinking about delaying school for 1 year, whatever age, high school, grade school, college, is that something at this time, the present situation we're in, is that advisable for you?
Okay, let me take it from two different perspectives. From the perspective of the university, we'd rather that they don't delay. Okay? But from the perspective of the student, very honestly, I think that's a brave decision.
Thank you, Professor. I want to bring in Professor Leyco as well. I want to get your thoughts on that.
Okay, thank you. I joined Pamantasan ng Lungsod ng Maynila last year, and furthest from my mind was to establish a virtual online campus. But I think education cannot be delayed. It cannot be stopped. I think the challenge before educators right now is how do you continue delivering education in a new order? So people are talking about going online, but there is the greatest digital divide. Again, in equity, in access to information, already show that, for example, in our campus, our students, less than 50% have access to a gadget, and less than 50% have internet connectivity. Before COVID, when we set up our budget last year, we earmarked money for our faculty to have computer laptops. That is, without COVID, we already planned to go to get connected. But this time, we have to do this overnight. We have to do this for our faculty. We have to do this for our students. Now, it's not just the gadget that is a problem. Our population comes from areas in Manila, Sampaloc, Tondo, San Andres, Pandacan, where for some reason, ang areas nila have very weak connectivity. No? And I think this is also going to be a wake-up call to our government. Ang connectivity ngayon ay hindi private matter. If you want everybody to get connected, we ask for free connectivity, free internet. If you're talking about going online, you have to free up internet. Hindi discount. Kasi sa aming area, pagka diniscount, hindi pa rin nila ma-afford yun. You have to give it out for free. You have to give out gadgets for free. So from our city, our city mayor was able to put together money that will allow for 100,000 something ETABs for our students. So that is one way. However, for us, it's not just going online. We are thinking about printing and then getting them delivered, or even using other means of communication to get them access to our materials. And finally, I think we have to consider going online is not just teaching, delivering your sessions online. Iba po ang delivery ng online. I've been a teacher for more than 25 years. When I teach, I look around the classroom and I look at the eyes of my students if they are able to connect. Nagkakaintindihan ba kami or hindi? Ngayon, pag nag-online ka, you're talking in front of a camera. You don't know what the other end, people on the other end is thinking.
Yeah.
No? So, ibang-iba ito. We have to train ourselves differently in this new order.
Before I go on with more questions, pasok po natin yung questions from our attendees. This is from Nikos Chris 2. Hi everyone, glad to be here. We're glad you're here too. Want to hear your thoughts on protesting during the quarantine period. Is that justifiable? Please answer, anybody.
For me, absolutely. As long as our protesters are able to keep physical distancing during their protest, I think it's justifiable. I love that aerial shot of a protest conducted in UP last week, which showed how well the people organized it and that the participants were distanced. So I think you want to weigh how important is that issue you're protesting about and how high that risk is. And so when you implement, the organizers need to be very disciplined and have to have good crowd control measures so that it doesn't turn into a petri dish for SARS-CoV-2.
All right, very quickly, one more. They call that the Mañanita protest, Dr. Dance.
Yes.
Anybody else? One more.
Well, if I may, I consider protests, particularly among schools, among students, essential to their learning. When you are learning something, you have to imbibe it. You have to believe it or you don't. And if you don't believe it and something is being shared, you have to be able to express what you think. And therefore, if you need to protest, you should be able to do so freely.
Okay, Mikael, I guess this is Agustin Guanlao is asking. Siguro ask this to Dr. John and Professor Tonette. Do you agree to open the classes on August 24? What are your thoughts? Kaya ba? Naku, masustain ang connections. Yeah, that's what we were talking about a while ago. Let's start with Dr. John. Do you agree with opening classes on August 24th?
Yeah, I think the opening of classes, one of the things that we're training in now, at least with regard to online classes, those universities that have access to delivering online classes, is what's called adaptability of delivery. So it follows the principle, no student left behind, no? So that online learning should be accessible even to those who don't have access, internet access. So that means printing out materials, putting them in a USB, making them available for people who don't have access. So it's in that context that I think adapting to the arrangements depending on each school is necessary, and for each school to be sensitive to those who will be left behind. So it depends on the institutions. Can I one about the education question earlier with Jasmine? I wanted to say, I was having a conversation this morning with a public school teacher. And in that conversation, and I just wanted to point out the cliche, it's a cliche that says, necessity is the mother of invention. In the context of that cliche, I want to point out that a lot of the teachers are anxious about the coming school year. A lot of the teachers don't know what to do. And I'm talking to several teachers now, and they're expressing, and I want to encourage more teachers to feel this way, to put themselves in this position. Now, it really does call out creativity and resourcefulness. There's talk before about radio, about distance learning over radio. What about TV, about harnessing a variety of media and not just online? So,
all right. Professor Tonette. August 24.
Again, I'm trying to empathize with the public school here. The bulk of basic education is in the public school system. And I really don't know if they can meet an August 24 deadline, honestly. Yeah, that's my fear.
Very
From
real.
a public university, we're not going to open on August 24. We will open on September 3rd. But I think that it's a must for us. I don't think we can afford, and I am of that belief that education cannot be delayed. It cannot wait, particularly at this time.
Okay.
I think this is the challenge for us. We have to be creative.
Let's have very quick answers, please, because there's still a number of questions. Private and public partnership is needed and vital in times like this. Cooperatives, NGO, and other people's organizations have been working hand in hand with government rather, like for instance, in the area of agriculture, where government supports farmers to improve their production. Question, how can we improve these endeavor in facing the new normal? I guess it's right, no, when we're talking about vulnerabilities, here's one again. And then here's where government can come in and probably really capture this and take advantage and take care of them.
I have a quick answer, Pinky. Don't tax that small sellers. Let them be.
What were they saying, Professor? Panahon pa daw to ni Pinoy during the time of BIR Commissioner Kim Henares. All right, anybody else? Farmers, agriculture.
The guide should be what is our economic priority. So let's do public-private partnership in food production.
Very good. All right. One more. Allah, from an anonymous attendee. How would you, no wait, I'm going to call out maybe, let's start with Dr. Dance. How would you assess the government's action towards this pandemic? Short and sweet.
The government, as in the DOH or the whole government?
The whole government.
Yeah,
DOH.
well, yeah, I think if any one thing is lacking for me, it's orchestration. But I think the individual actions, I appreciate everything that the Department of Health has done. These people there are working day and night and putting themselves at risk and have not received a lot of appreciation. I appreciate that the interagency task force meets until midnight to discuss different approaches to the problem, and all the technical advisory groups to the interagency task force and the national task force on implementation, the Department of Transportation and the DILG are all doing what they can. And I think in the principle of solidarity, we should support all these different branches of government. If there's anything lacking for me, it's orchestration, so that there's a lot of disagreement that's unresolved. People are not talking to each other all the time, and there's some leeway for improvement for me, but I think that's something we can work on in the coming weeks.
All right, Dr. Dance, I know you have to go, right?
That's okay. I'll stick on as long as I can.
Maybe you want to hear the answers of the rest. Very quick answer.
Yes.
Thoughts. This is the last part. Your thoughts on the government's response on the COVID-19 pandemic. Let's go to Dr. John.
The problem is so complex. The problem is so complex, and I think many of the things that we said during this webinar revealed those problems, those vulnerabilities. So just like Dr. Angeles said earlier, I would hate to be in government now because of just how difficult it would be to navigate that complexity. So I mean, even dealing with personalities and dealing with a variety of interests, I think the government in this case is doing its best, and I'm happy with the way the government, I mean, it's not perfect, but it's navigating its way with the imperfections.
Let's go to Professor Leyco.
Well, I wish I could give you a short and sweet answer, but let me start. I think it was a major failure on the part of the WHO because they prolonged the declaration. They should have declared the pandemic and epidemic way, way, way before, perhaps early January. It's a major failure on the part of China because they knew that there was already an unexplained epidemic going on, and therefore they should have closed off the borders. The pandemic is a panic button that they pushed, and therefore, instead of containing it within Wuhan, it spread out outside Wuhan. It spread out across the country. And I think in terms of the country's response, I think even though there was already a lot of talk about the pandemic, potential pandemic going on, up to February, I believe, there were still straight flights coming in from Wuhan, from China, to Boracay, to Cebu. You know, I think aside from orchestration, I think we should have acted much, much earlier on. Now, having said that, I believe that the government response should now be should now include in a major way logistics management and economic decisions now.
All right. Professor Tanet.
Very similar to Professor Dr. Dans. I think looking forward now, I think the government should really work towards coordination because individual agencies may be doing their jobs well, but I don't see an orchestra conductor really orchestrating the whole thing. So perhaps coordination. And then I think they really have to work at their communication. Charismatic spokespersons who will give us clear, simple, accurate facts which we can trust. Informatics that is digestible by simple people. And then finally, now that we are in GCQ in Metro Manila, consistent monitoring so that people don't backslide for whatever reasons they may have. I think we really have to monitor.
I think that somebody told me that we were talking about we should act. I mean, really at the end of it all, let's all act as if we have the virus. That means we're trying to protect ourselves and we're trying to protect the person in front of us or beside us. So much, I've learned so much from all of you. I'd like to thank you all for giving us an hour and a half, actually 2 hours because we were all together at 3:30 already of your time. Thank you to all our guests. Professor Tanet, maraming salamat po sa inyo. Dr. John Bulaong, also thank you to you. Dr. Dans, thank you also.
My pleasure.
Thank you. And thank you for staying. And Professor Leyco, maraming salamat din po sa inyo. Thank you all.
Maraming salamat.
Thank you, Pinky.
Thank you. Bye, everyone. I hope to see you again and interview you again on another topic. Thank you. As we have been saying, we have this shared responsibility during this pandemic and even beyond. It's all about personal and public choices we make because at the end of the day, we are in this together. I'm Pinky Webb. Maraming salamat po sa inyo. This has been the CNN Philippines special presentation. Thank you for joining and let's all stay safe. Bye, everyone.